Hi, today we want to talk a little bit about administering insulin for our diabetic patients. Both dogs and cats can become diabetic, which is a situation that develops when the body is not producing enough insulin. Most of our diabetic patients need to be treated by receiving insulin, and we have here the two most common, not the only types, but the most common types of insulin that we use here at Seiler Animal Hospital. Most of our cats are on Prozinc, which is a U40 insulin. It's important to know that cat insulin is U40 and dog is U100. That's a difference in concentrations because you need to be sure to give the specific insulin with a specific type of syringe. Otherwise, you could inadvertently either give too much or not enough insulin. So in talking about the cat insulin first, the Prozinc, the U40 insulin syringes that we use will say U40 on the syringe, and the bottle will say that on the bottle. So you always want to make sure that you're using the appropriate syringe, again, with the appropriate bottle. Now, the syringes come, the ones that we use most commonly, and there are different size syringes and different size needles. This is a 1/2 ml, and I think it's a 28 gauge needle, which is a tiny little needle. They come as such with a cap over the plunger, and that cap just comes off, and a cap over the needle, and that cap just comes off also, and the needle is present very tiny. Put the cap back on for the rest of our demonstration. On the side of the syringe, you will see actual units, and this one goes from 5 up to 20. Most cats receive somewhere between 1 and 4 units. It could be a little bit more than that, depending on the kitty, from time to time. And that is measured to the very top of the plunger, which can be moved up and down. When it's all the way up, it's at 0. And each line, as you draw it down, is 1 unit of insulin if you're using the proper insulin. If, for instance, we wanted to draw up 2 units of insulin for a given patient, and I'm going to use this little bottle of saline for our demonstration, the bottle has got a rubber stopper with a ring on it, very similar to what's actually on the insulin. When you draw up the appropriate amount, you take the cap off, the needle is inserted right in the center, the bottle is inverted so that the tip of the needle is in the liquid inside, and then holding the bottle and the syringe, you will draw the plunger back to the appropriate amount, and usually you want to draw a little more than what you're going to ultimately give, so that you can make sure that there's no air bubbles of any substance inside, because any air bubble that's in there is displacing that amount of insulin. And I'm going to push it back up, and there I can see that there's no bubbles in there. Draw the plunger back to the appropriate level, and right there, if you can see, we drew the plunger so that the top of the plunger is at the second line. This would be the appropriate dose, 2 units, for a cat that was receiving that much to treat diabetes.